Welcome to Comfort Time with Aunty Yunike, where we share testimony stories. Today's story is cancer yet again. This is a different cancer from the prostate cancer that we shared with you. It's different from the breast cancer that we shared with you. We've touched a bit on cervical cancer, but today Professor Boniface Mwamba Kawembe is here with us, and we're so grateful to talk to us on yet a different type of cancer. Professor, welcome to Comfort Time once again, and thank you for coming.
Thank you so much. It's always a great pleasure to share this platform with our viewers.
So today's story is a cancer that Professor will explain to us. But Professor, before you go into explaining, can you please tell us once again what cancer is?
Cancer is a disease of body cells. You know, if you were able to break down our bodies, the smallest unit, the building unit of our bodies is what we call a cell. And in cancer, these cells have the ability to multiply, and they know when to reproduce, and they also know when they should stop multiplying or reproducing. The cancer cells also have a program on board which tells them that when they become old, they should let go and die and be replaced by new cells. Now, this condition we call cancer, this is what this is our current understanding of cancer today, is that something goes wrong with the control mechanisms. Think of it this way. Think of a cancer cell as a car. A car has two pedals, the brake pedal and the accelerator. And now, imagine if the car cannot stop, what will happen?
Accident.
It will crash.
It will kill you.
Okay? Now, it's very similar to what happens in the cell.
Wow.
This cell is programmed to multiply, so it starts multiplying. But in cancer, there are no brakes, so it doesn't know when to stop.
Wow.
It just continues to multiply, and it ends up as a growth, an abnormal growth.
Okay.
The other aspect with cancer cells is that when they are old, they should give way and die.
Okay.
Now, with cancer cells, they don't stop. They just continue. Imagine if all of us never grew old, we just lived on and on.
Lived on to a happy 1,000 years.
And
okay.
This is our current understanding of what cancer is, that it is the loss of those normal controls. Normal cells multiply, and they know when to, there are brakes to stop them from multiplying. Normal cells die when the time comes. Cancer cells don't. And this creates new problem. The new big problem is that cancer cells, normal cells, okay, they respect boundaries. Cancer cells don't.
They don't.
You know, in fact, cancer would be a relatively easy disease to treat. Like, imagine if it only affected the breast and it stayed in the breast. Because then you would say, okay, we'll go in and cut off the breast,
yeah,
and we'll have taken care of the problem.
Yeah.
But unfortunately, these cancer cells don't only grow abnormally in their location of origin, they also spread to other organs and start growing there. So that what began as cancer of the breast
can be cancer of anything.
Cancer of the brain, because the cancer cells from the breast have spread to the brain, they have spread to the liver, they have spread to the kidneys, they have spread to the lungs.
Okay, so Prof, before you go into the cancer that we're talking about today, I know that we've had people have growths in different areas, and they have said they're just growths, they're not cancerous. What is that all about?
I think that's a very important point that you have raised. So when we see a patient coming to us, healthcare providers, with what they consider an abnormal growth, it does not mean all abnormal growths are cancerous.
Okay.
So the first question we ask ourselves, yes, this is an abnormal growth. Okay? Now we ask the next question, which is it cancerous or not?
No.
Now the difference is that cancer cells, apart from what I have described, have this special ability to spread and start growing in new sites.
Okay.
That is a feature of cancers.
Okay.
Now, what we call benign growths, or the non-cancerous growths, they will only grow in that one area and don't have the ability to spread.
Oh, okay.
So that if you have a breast lump, the question which confronts the doctors, yes, there is a lump. And by the way, by just looking at an abnormal growth, you can't tell with the naked eyes whether it's cancerous or not.
Okay.
You have to examine a piece, which we call a biopsy, of that abnormal growth and examine it under the microscope.
Okay.
It's only examination under the microscope which will tell you whether it's cancerous or not.
Okay.
And also by looking at the cells, you find that benign growths, yes, it's these cells which have multiplied, but they are normal in appearance under the microscope.
Okay.
The cancerous cells under the cell microscope will be obviously abnormal.
Okay.
So the non-cancerous growths are just like normal cells which have over-multiplied,
Okay.
but they are normal looking under the microscope.
Professor, today is a special day in that today's cancer is different from the cancers that we know about or normally speak about. So what is this cancer that you are explaining to us today?
Today we are looking at cancer of what we call the gastrointestinal tract. This is part of our bodies which starts at the level of the esophagus, goes down to the stomach, the small intestine, and the large intestines up to where it ends at the anus. Now, this whole part of our body I have described is lined, has a special lining which we call the mucosa. And what we are going to share today is the cancers that arise from the lining of the gastrointestinal tract. So we are looking at the lining of the esophagus, the lining of the stomach, the lining of the small intestine, and the lining of the large intestine. Now, one of the interesting things, and why we are looking at, in a sense, if you look at organs, we are looking at the esophagus, we are looking at the stomach, but there is a very good reason why we want to look at all of them. One is because they have a common lining, although this lining in the esophagus is specialized, the stomach is specialized to do certain important things for the body.
Okay.
But the major reason why we want to look at all these cancers, like we are taking a lot of cancers all together.
Okay.
One of the major reasons why we are doing that is that, again, we are going to that same important message. How can we detect cancers of the esophagus, the stomach, the small intestine, the large intestine. How can we detect them early?
Okay.
And we are lucky now that there is a way of detecting these cancers early.
Okay.
Using equipment which we call an endoscope. Endoscope is a word made up of two words.
Okay.
Endo simply means inside. Scope means looking.
Okay.
So endoscopy, or this endoscope, is a piece of equipment which allows us to take a look directly into the esophagus, into the stomach, and we can even look in the large bowel.
You put it in this?
Yes.
What?
Yes.
How do you do that?
Well, we'll talk about the how.
Whoa.
as we go along. Now, I think what is important is that whether we are talking about cancer of the esophagus in its early stages, cancer of the stomach in its early stages, even of the small bowel and the large bowel, has no symptoms.
Okay, so mostly like other cancers.
Exactly.
So
painless
like
completely, yes.
Painless again.
Painless, and you feel perfectly fine.
Oh boy.
You feel on top of the world.
Oh dear.
Okay?
Okay.
So by the time, for instance, if you have cancer of the colon, and that colon, you see blood in your stool.
Oh, that's an indication.
It's late.
What?
That's late.
Oh dear.
Yes.
Oh dear.
Okay? By the time you're having difficulty swallowing, it's probably you are now dealing with cancer which is advanced.
Oh my God.
By the time you touch your stomach and you feel there is a lump there, maybe due to cancer of the stomach.
Yes.
The cancer is very advanced. Okay. So again, we are on this theme, on this important, how do we pick up these cancers early?
Okay. But Professor, I've known of someone who had colon cancer, and all they did is cut some bits and pieces of the colon and they survived. So, is it possible to do that?
Yes, but in fact, the scientists have studied how these cancers develop. They begin as little lumps, which we call polyps. Especially if you are talking about, the colon. They begin as small growths, like little pimples. And in fact, when they begin, they are not cancerous. So, but as they grow, they pick up the characteristics of cancer. And what this means is that if you find these polyps, you can remove them without requiring a major operation.
So that's probably what happened in that case.
Yes.
Okay.
Now, obviously, I think, let's again emphasize what is very important. Okay. Early cancers of the esophagus, the stomach, small bowel, and the large bowel are painless. You don't feel anything.
So, Prof, what I know we've talked about what causes it, and I'm looking at this being, especially like say the colon. I'm looking at it and thinking, is it because of the food that we eat, the drinks? What aggravates that kind of growth?
What we have seen in this country, in what we can call even Sub-Saharan Africa, is that there is a new group of diseases which are becoming increasingly more frequent, which we call non-communicable diseases.
Okay.
So broadly, we separate diseases in two broad categories. Category 1 are the communicable diseases, the HIV,
Okay.
the measles, tuberculosis. Those are in the category of communicable diseases.
Yes.
These are diseases which can be passed on from one person to another.
Okay.
Now the cancers are in a category which we call non-communicable diseases. Okay. So if I have cancer of the stomach,
Yeah.
and you are my wife, there is no way you are going to get that cancer.
Okay.
I cannot pass it on to you.
Okay.
When we were growing up, when I was young, and even during my training in medical school, we didn't see a lot of cancers in general.
Yeah.
But today we are seeing more cancers. I'm sure the fact that the population today is bigger, it may be a contributing factor. But what you have alluded to, that the diet may probably play a role.
Big role, yeah.
Yeah.
Okay.
Now the other diseases which I think we'll need to come and discuss because they are a cause of a lot of suffering and death include high blood pressure,
Okay.
sugar disease, diabetes,
Yeah.
just to mention two non-communicable diseases.
Okay.
So that we are seeing a lot more of these cancers. And if you look at our colleagues in the developed world, like in the United States, in Europe, Western Europe, cancer of the colon, for example, was the second leading cause of death
Okay.
among Americans and Europeans.
Okay.
And this is what they did. They said by the time the patients complain, okay, whether it is that they are seeing blood in the stool, or they are not failing to pass stool altogether, they are obstructed.
Yes.
By that time, these cancers were advanced.
Okay.
So they came up with a rule,
Okay.
I would probably say almost a law, to say, because they noticed that cancers of the colon are most common from the age of 50 and above.
Okay.
So they said, all our citizens, when you reach the age of 50,
Okay.
when you are feeling perfectly fine, as part of your annual physical exam, or when you visit your doctor, you must undergo colonoscopy. You must undergo endoscopy.
Okay.
And since they started doing that, the number of people dying from cancer of the colon has dropped by 75%.
Wow. That's
And
awesome.
the cancers that they are picking now are small, and
So
most
they're
of
able
them
to
are
help.
curable.
Okay. Well, that is a good law to have. I think it wouldn't hurt to copy that kind of law.
But obviously you need the facilities
Ah.
to go along
Okay.
with that.
We're back to that.
Yeah. Now, in our situation here, we should not reinvent the wheel. Okay? We should just borrow what has been shown to work, which is in this country too. When anybody reaches the age of 50, they must have their colon checked.
Yes. Okay.
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 Now, obviously we have a large population. Okay? And here we have two problems. One of the problems is that endoscopy or colonoscopy, which allows us to pick all these cancers I've talked about early, is not yet widely available.
Okay.
In fact, once upon a time, it was only UTH who had that capability.
Okay.
Now, Levy Teaching Hospital and a lot of our private hospitals are able to do these tests. But obviously there is still the challenge, how do we spread these services to the rest of the country, especially
Professor,
away from the line of rail?
No, Professor, I think looking at it as a challenge is accepting that we have failed, and I don't think we have failed.
No, I
Just
don't
the
think
same way we were talking about breast cancer, that we needed mammography machines in
Yes.
all the districts.
Yes.
I think this can be a second campaign on the same, because if we talked of CDF, constituency development funds, which is being increased yearly.
Yes.
And if we are looking at enjoying what is being put in place, we actually do need to fight for the good health of the people. So I think that is one campaign we can focus on too.
Exactly.
Yeah.
In fact, I think maybe as a first step, it would be nice to have endoscopy services available at every provincial center.
Yeah.
And then from there move on to every district hospital.
Yeah, I think it's doable, Professor. It's doable.
I think that's where we should set our sights.
Yeah.
Yeah.
Because the Ministry of Health is working very hard trying to ensure that we have a healthy population.
Yes.
The president says everybody must be educated. So beyond being educated, we need our health.
Exactly.
Yeah, so I think this is something that we can actually engage the powers that be to be involved in and fight for.
And I think one point which would be important to bear in mind is that whenever complaints develop, problems develop, if you find you are been having abdominal pain, okay, we all experience abdominal pain at one time or another, but if that seems to be coming back, persisting, I think we should make ourselves available, have those complaints investigated. Okay, let's not just take pain medications if you have pain.
Self-medication.
Self-medications. It's okay for a few days and if things work out well and good.
Yeah.
But if it doesn't, it's important to see your healthcare provider and have that problem investigated. And I think the other important point to remember is that generally speaking, yes, cancers also occur in young people, even in children, they do occur, but most of the cancers tend to occur as we grow older. So that if you are faced with a 50-year-old gentleman is complaining of indigestion or gases, that's the popular one.
That's what I wanted to ask.
Yes.
I've heard so many people, when I say, what's wrong with you? I think what am gases.
Yes.
I've been diagnosed with a lot of gases. So I really don't understand. What are those gases? Because I know that our eating habits contribute to a lot of things, because a lot of people prefer to have like a main meal and then eat fruit after. And I always say you can't have fruit after you have had your main meal.
Yes.
Because fruit will stay in the stomach for 20 to 30 minutes and then it needs to go out. But a main meal stays longer, 2-3 hours, even longer. So if you've eaten a main meal and then you put fruit on top, then when it's done, it has nowhere to go. Then I don't know if that's what causes that. That is what I've been thinking. But is that what happens? Where are the gases coming from? It seems to be very common these days.
It is absolutely normal to have gas.
Okay.
In our oesophagus, our stomach and intestine. That's perfectly normal.
Okay.
In fact, 80% of the gas which we find there is swallowed air.
Okay.
So when we swallow saliva, when we swallow drinks or swallow food, we also swallow some air.
Okay.
So it's perfectly normal to have gas, so to speak, in the intestines. The other 20% is produced by the bacteria, which are within, mostly in the small and large bowel.
Okay.
Now, I must also confess that I don't know what these gases mean. I am on a WhatsApp group of doctors, and we have been asking ourselves, where has this come from?
They're so common.
Yeah. So, and we've been wondering, is it because gastritis? Is this a corruption of gastritis? Because gastritis is a very common condition. Maybe we as doctors, when we tell our patients that you have gastritis, they'll go home and say, I have gases.
Okay, but what is gastritis now? Can you explain?
It's just inflammation, irritation of the lining of the stomach. That's what gastritis.
And it doesn't make you produce gas?
No, it doesn't. But I think what is important, when people say I have gases, they come to us complaining of gases. And if they are, I would say even from 45 and older, we must investigate them. Okay. A young person who is 18 years old says I have gases, maybe we can just give them, let's try this medicine, let's try that medicine. But for anybody older, we should investigate them. Okay. It's very important that we investigate them, because that's the only way we'll be able to pick up the cancers that we are talking about, of the esophagus, of the stomach, of the large bowel.
Okay, so Professor, if you say most of the gases we have is from the bacteria, the air we swallow, so
it's normal.
Okay, if it's normal, are we able to pass it out the normal way?
Yes.
So, and then, because I heard someone was saying she's got those gases, and the doctor said as long as you drink lots of water, even as you pass it out in the normal way, it will not smell, because the water will take care of the digestion. Is that a true picture of what is supposed to happen?
No. I think what is important is that, for instance, when you do a scan, when you send, they will see gas there. It's normal.
Okay.
But when they do that scan, they can sometimes see that this person has a lot more gas than normal.
Okay.
And particularly if you are having difficulties, you are not passing flatters, you are not passing wind.
Yes.
That is serious. It should be investigated.
But it's the wind I'm interested in. Should it be smelly, or should it just be like nobody should even tell that you're passing wind?
It's normal.
What is normal? The smelly part?
The smell is part of us.
Okay. Because I'm thinking if
there is nothing abnormal.
So it's not true that the more water you drink, the less it will smell.
No, it is healthy to take lots of fluids. But I don't think the water itself will influence the smell of the flatters.
So thank you very much, Professor, for all this information. It's a lot of food for thought. Is there anything else that you would like to share with us, or share with the viewers on the topic, maybe not only on this topic, including other topics we've covered?
In conclusion, I have 3 appeals that I would like to make. The first appeal is to all those who have a history of cancer in their family. They should seek medical advice early. If the recommended age for checking the colon is 50 years, for them they should do it from the age of 45, 40 and 45 and above. The second appeal is to all of us who are more elderly. We should not be dismissive of any little complaint. Anything you feel, have it checked out. And my final appeal is to the private sector, to our government, to think of ways of increasing the availability of endoscopy services, maybe initially at the provincial level, but to be followed up by spreading these services to all our district hospitals. That will help us pick these cancers early and reduce the suffering and unnecessary deaths that result from these cancers in particular and from cancers in general. Thank you.
Thank you so much, Professor. And you've referred to the government coming in to help us. And I'm again saying we have a CDF that we can tap into. So I too would like to appeal to the members of parliament to ensure that not only do they look at mammography machines, they should also look at other machines that can help with the health of our people. Just as we are looking at education, if we can have an educated community, we also have a healthy community, it's a win-win situation. So don't be scared. When you look at the cancers that we have discussed here, we've discussed prostate cancer, we've discussed breast cancer, and it's a bit about cervical cancer. They all sound so scary, and I know I've said it's scary, but there's no need for us to be scared. We have a solution, and our solution is just being tested all the time and catching these cancers early. So let's have ourselves tested, let's catch them early, let's be healthy for ourselves, for our children, for our grandchildren, and for the community at large. So thank you so much. For those who have subscribed, I'm saying thank you. Those who are waiting, please do, and always remember to give us a thumbs up. This helps everybody else to see the stories we're sharing. Comfort Time continues. Stay blessed. See you in the next video.